We rise up strong and bold, our voices heard, our stories told. Indigenous power, a force unseen, a new dawn breaks a future seen. Timely trends of guiding light, news that's true, shining bright. Indigenous voices, a powerful sound, uniting our people's sacred ground.
I gotta say, I really do love how that theme music just gets you ready to learn something new. It's like it sets the stage for our curiosity.
It does,
Uh,
yeah. It's like we're setting off on some big adventure to uncover some hidden knowledge.
exactly. And today's adventure is all about Health Canada's Substance Use and Addictions Program,
Man.
SUAP.
That's UAP.
So we're going to be breaking down exactly what it is, who it's for, and how you can even get involved.
Sounds like a plan.
Let's dive right in. What is this program all about?
Well, SUAP is basically this program that's run by Health Canada, and they offer funding to organizations all across Canada who are tackling substance use issues.
Oh, that's interesting. So it's like the government is giving money to these groups so they can help people who are struggling.
Yeah, exactly. It's a way for the government to support, all these different community groups, researchers, and organizations who are really on the front lines of dealing with substance use.
That makes a lot of sense. So it's not just like treatment centers or
Yeah.
something.
Nope. It's way more than that. They're looking at the whole picture. So prevention, harm reduction, and treatment.
Wow. They're really covering all the bases.
Yeah, and they're not just focused on one substance either. They're addressing a whole range of them. Everything from like opioids and stimulants to alcohol and tobacco.
It sounds like they're really trying to make a big impact. So who exactly can apply for this funding? Can anyone just apply?
It's specifically for organizations, not individuals.
Okay.
So we're talking about like not-for-profit health organizations, charities, educational institutions, different levels of government,
Okay.
including Indigenous governments, and even First Nations, Métis, and Inuit not-for-profit organizations.
That's a pretty extensive list.
Yes.
It seems like they're really trying to reach a lot of different groups with this.
Yeah. They want to make sure these funds are available to a wide range of organizations that are working to address substance use issues.
But I'm guessing there are probably some exceptions, right? Like who can apply?
You're right. Individuals can't apply directly, and neither can for-profit groups or federal crown corporations.
Okay, so those are kind of the no-goes.
Right, but here's the thing. Even though those groups can't apply directly, they can still be partners on a project.
Oh, so there's still a way for them to get involved.
Yeah, exactly. If they team up with an eligible organization, they can still be part of the solution.
That's really smart.
Yeah.
It ensures that the money is going to organizations that are, set up to handle these kinds of projects, but it still allows for collaboration.
Yeah, it's a good balance.
That kind of makes you realize how much thought actually goes into creating these funding structures.
Oh, for sure. There are a lot of factors to consider.
Yeah. So to give us a better sense of what SUAP is all about, can you tell us a bit about their priorities?
Absolutely. Let's take a look at the focus areas from their 2023 call for proposals.
Okay.
They had 4 main priorities that they were really emphasizing.
Fill us in.
All right, so the first one was all about empowering people with lived and living experience.
Okay, so people who have actually experienced substance use firsthand.
Exactly. They often refer to this as PWLLE.
Okay, got it. PWLLE.
And it's basically recognizing that those who have direct experience with substance use have really valuable insights to share.
Yeah, that makes a lot of sense. Who better to understand the challenges and what might actually work than the people who've been through it?
It's about bringing those voices to the table and making sure they're part of the solution.
I love that.
Mm.
What about the other priorities? What else were they focusing on?
So the second priority was all about supporting services and programs that help people transition back into the community after treatment.
Okay, so it's like providing support for people after they've completed a program.
Exactly. It's like building a bridge to a healthier life, helping people stay on track and avoid relapse.
That's so important because sometimes just finishing a program isn't enough, right? People need that ongoing support to really make those changes stick.
Exactly. And that's what this priority is all about.
I'm really liking what I'm hearing so far. What were the last 2 priorities?
All right. So the third one was focused on addressing alcohol use disorder.
Alcohol use disorder.
Oh, and this included promoting things like screening, brief interventions, and referral to services.
Screening, brief interventions, and referral to services.
They even have an acronym for it, SBR.
Okay, SBIR.
Got it. Basically, they're trying to catch alcohol-related issues early on and connect people with the right resources.
It's like a proactive approach.
Exactly. And then the final priority area was all about tackling adult tobacco cessation.
Okay, so helping people quit smoking.
Exactly. They're looking for innovative ways to support people who want to kick the habit.
So we've got prevention treatment, harm reduction, and even specific focuses on alcohol and tobacco.
Yeah.
It's pretty amazing how much ground SUAP is covering.
Yeah, they're really trying to address substance use from all angles.
I bet some of our listeners are already thinking, hey, I've got this amazing project idea that fits right in with all of this. So what do they need to know to apply for this funding?
Well, the first thing to know is that the 2023 call for proposals has actually already closed.
Oh, no. I was just about to ask about how to apply.
Yeah, unfortunately, that window has closed.
But I guess that doesn't mean our listeners shouldn't get excited about future opportunities.
Not at all.
Yeah.
It's always a good idea to be prepared. And when the call for proposals does reopen, you'll want to head over to the SUAP page on the Health Canada website to find all the application guidelines.
Okay, so bookmark that page.
Exactly. And it's worth noting that the grant amounts can vary depending on the project, but they can go up to $5 million over 5 years.
$5 million. That's incredible.
Yeah, it's a significant investment in tackling substance use.
I'm guessing the application process is probably pretty intense. Is there any support available for organizations that want to apply?
Yeah, for sure. Health Canada actually held an information session earlier this year to guide potential applicants. And you can actually request a copy of the recording and presentation from that session by emailing SUAP.
Okay.
That's SUAP-PUDS@hac-se.gc.ca.
We'll make sure to include that email address in the description box below, too.
Perfect. So yeah, even though the current round is closed, there's still a ton of information out there for anyone who's thinking about applying in the future.
It's never too early to start brainstorming those amazing project ideas.
That's right. Get those creative juices flowing.
So now I'm really curious to see what kinds of projects SUAP is actually funding. Can we dive into some examples?
Absolutely. It's fascinating to see how these priorities translated to real-world action. Let's start with a project that really highlights that focus on people with lived experience.
Okay.
The Canadian AIDS Treatment Information Exchange, or CAIDI for short, is developing plain language resources about harm reduction for frontline workers.
Oh, that's so important. Making sure that information is accessible and easy to understand is crucial, especially for people who are working directly with folks who use substances.
Exactly. It helps ensure that those frontline workers can approach these situations with, knowledge and empathy.
It's all about meeting people where they're at, right?
Exactly. Now, another great example is a project by the Belleville and Quinta West Community Health Center. And they're actually adding nurses and a peer harm reduction team to their drop-in program for people experiencing homelessness.
That's amazing. Integrating those services directly into a program that already serves a vulnerable population can make a huge difference.
Absolutely. It's about breaking down those barriers to access and making sure people can get the support they need in a place where they already feel comfortable.
So we've got Katie empowering frontline workers and the Belleville and Quinta West Community Health Center providing those integrated services. I'm already seeing how impactful these projects can be. What other innovative approaches are out there thanks to SUAP?
Well, in the realm of alcohol use disorder, the Center for Addiction and Mental Health, better known as CAMH, is developing training programs for healthcare professionals, specifically on how to manage cases where individuals are dealing with both ADHD and substance use.
Oh, wow. So it's recognizing that these situations can be really complex.
Exactly. It's not always a straightforward situation.
Yeah.
And it's important to equip healthcare providers with the knowledge and skills to navigate those complexities effectively.
Yeah, because a one-size-fits-all approach definitely isn't going to work in those cases.
Right. And then for our final example related to tobacco cessation, the Ottawa Heart Institute Research Corporation has a project that's establishing regional hubs to support smoking cessation.
Okay, so they're creating these centers where people can go to get help quitting smoking.
Yeah, exactly. And they're basing these hubs on the Ottawa model, which has actually proven to be very successful.
So it's like they're taking something that works and expanding its reach.
Exactly. It's about building on those evidence-based practices.
I love that. So we've got Katie empowering frontline workers, the Belleville and Quinta West Community Health Center providing integrated services, CAMH training healthcare professionals, and the Ottawa Heart Institute expanding smoking cessation support. It's amazing to see the range of projects that SUAP is making possible. And while we can't apply right this second, I have a feeling our listeners are already buzzing with ideas.
Oh, I'm sure they are. And actually, I should mention that the next call for proposals is anticipated for late 2024.
Oh, perfect.
Yeah,
That gives everyone plenty of time to start dreaming big and crafting those game-changing proposals.
exactly. Start thinking now and be ready to hit the ground running when those applications open up.
And remember, folks, that application link will be in the description box below so you can bookmark it and be all set.
Great idea. Better to be prepared.
For now, though, let's keep unpacking SUAP. What else should our listeners know about this program and its broader impact on how we're tackling substance use in Canada?
Well, I think it's crucial to emphasize that SUAP represents a pretty major commitment from the Canadian government to address substance use as a public health issue. This funding isn't just about reacting to a problem. It's about proactively investing in solutions that can prevent harm, promote well-being, and ultimately save lives.
That's so powerful. It's really shifting the conversation from blame and judgment to compassion and support.
It's about recognizing that substance use is a health issue, and it deserves a public health response.
And by funding such a diverse range of projects, SUAP is acknowledging that there's no one-size-fits-all solution. It's really about empowering those communities to find what works best for them.
You got it. It's about recognizing the unique needs and experiences of different populations and making sure that the approaches are, culturally relevant and trauma-informed.
I love that. So we've learned what SUAP is, who's eligible, how to get ready for future applications, and even got a glimpse of all the amazing work being done across Canada.
It's pretty inspiring stuff.
It really is. But before we get too carried away.
It's easy to get kind of caught up in all those details.
Yeah.
So I think it's good to step back for a minute and, ask ourselves, what does this all mean for the listener?
Right.
Even if you're not planning to, apply for funding yourself, just learning about SUAP can spark some new ideas and maybe inspire you to get involved in your own community.
I love that. Sometimes just hearing about what other people are doing can be that little nudge you need to be like, hey, I could do something like that too.
Absolutely. And what's really exciting is this emphasis on innovation.
Yeah.
SUAP isn't just about funding the same old approaches. They're really pushing boundaries and exploring new ways to tackle these issues.
Totally.
For example, Simon Fraser University actually has this project where they're developing wearable technology that can detect overdoses and alert emergency services.
That's incredible.
It's amazing, right? Using technology to literally save lives.
Like that's the kind of out-of-the-box thinking that SUAP is encouraging.
It's remarkable, and it really shows the potential for harm reduction strategies to become even more effective with the help of technology.
Yeah, technology can play such a huge role. I'm also really intrigued by the projects that are integrating substance use support into other healthcare settings.
Oh, yeah, for sure.
Like the Queen Elizabeth II Health Sciences Center in Halifax is a great example. They're developing this inpatient addiction medicine consult service.
Oh, wow. That's interesting.
Yeah.
What's so cool about that approach is it recognizes that substance use often goes hand in hand with other health issues.
Right.
So by integrating that support into the healthcare system, it makes it way more accessible for people who might not otherwise seek help.
Totally. It's meeting people where they're at.
Exactly.
And providing support in a way that feels, comfortable and familiar.
Speaking of meeting people where they are, we can't overlook the importance of culturally safe and trauma-informed approaches too.
Oh, absolutely.
Which, is a huge part of many of the projects funded by SUAP.
Yeah, because everyone's journey with substance use is so different.
Exactly. And it's shaped by their unique experiences.
A one-size-fits-all approach just doesn't work.
Nope. It doesn't. And that's the beauty of SUAP, They're funding projects that are really tailored to the specific needs of diverse communities.
Yeah.
Whether it's Indigenous communities, LGBTQ plus populations, or newcomers to Canada.
It's about recognizing that there are these systemic barriers and working to break them down.
Yes.
So that everyone has an equal opportunity to access the support they need.
Absolutely. And this brings us to another crucial piece of addressing substance use.
Okay.
Challenging the stigma that surrounds it.
Yeah.
Stigma is so pervasive and harmful.
It is.
It stops people from getting help. It isolates them from their communities. And it just perpetuates all these negative stereotypes.
It's like this huge weight that people are carrying around.
Exactly. And what's encouraging is that SUAP is funding projects that are specifically designed to combat that stigma.
Oh, it's amazing. Like what?
So, for example, the University of British Columbia has this project where they're developing a national public awareness campaign.
Okay.
And it's all about reducing the stigma associated with substance use.
That's awesome. So it's about changing hearts and minds.
Exactly. Creating a society where people feel comfortable talking about their struggles.
Yes, and seeking support without feeling judged.
Precisely. It's about fostering this culture of compassion and understanding.
Okay, so just to recap, we've explored SUAP's really comprehensive approach.
Yeah.
From prevention and harm reduction to treatment and aftercare, we've looked at some seriously innovative projects they're funding,
We have.
from things like wearable technology to integrated healthcare services.
Mhm.
And we've talked about how important it is to include people with lived experience, address systemic barriers, and challenge that stigma around substance use.
A lot of great points.
It's been quite the deep dive.
It has. And, as we wrap up this part of our exploration of SUAP,
Yeah.
I want to leave you with a question.
Okay.
What will you take away from this conversation today?
Ooh, that's a good one.
What really resonated with you?
Yeah.
What piqued your interest?
Was there anything that you learned that shifted your perspective at all?
Maybe you're feeling inspired to learn more about substance use issues in your own community,
Yeah.
or to support those organizations working on the front lines.
Or maybe you're thinking about how you can challenge stigma in your everyday life.
Mm.
Or just have more compassionate conversations about substance use.
Whatever it is, we want to encourage you to hold on to that feeling, that sense of possibility.
Yes,
Because even small actions can have a big impact.
they really can.
Whether it's donating to a local organization, volunteering your time, or simply having a conversation with a friend or family member, every act of compassion contributes to a more supportive and understanding society.
So well said. It's a reminder that we all have a role to play in creating a world where everyone feels safe and supported to seek help and to live a life free from stigma.
And as we all continue to learn and grow together,
Yeah.
it's really exciting to think about what the future holds for innovative solutions to address substance use.
Absolutely. And if SUAP is any indication that future is bright,
Yeah.
it's full of hope, possibility, and a genuine commitment to creating a healthier and more just society for all.
It's been really cool exploring this whole world of SUAP with everyone.
Yeah, it has.
We've covered so much, from like their core mission to all those amazing projects they support.
Yeah, and what really stands out to me is how SUAP really shows a shift in how we think about substance use in Canada.
Oh, definitely.
It's not about punishing people or judging them.
No.
It's about supporting communities and investing in solutions that put health and well-being first.
I think you've hit the nail on the head there. It's a real change in perspective.
Mm.
And I think that's especially clear in their commitment to harm reduction.
Harm reduction, yeah.
It's not just about saying don't use substances. It's about meeting people where they are and giving them the tools and support they need to make positive changes.
Exactly. And we've seen that in so many of the projects we've talked about today.
Yeah.
Whether it's providing naloxone kits to prevent overdoses or offering safe consumption sites, these harm reduction strategies are literally saving lives
They are. They're making a huge difference.
and reducing the negative consequences that can come with substance use.
And something else that's really important is that focus on involving people with lived and living experience.
Absolutely. Their voices are so crucial.
They have such valuable insight into what actually works and what doesn't.
Yeah, they've been there.
And they can help shape programs and policies that are actually going to be effective.
It's about recognizing that people who have lived through these challenges are experts in their own right.
Exactly. And SUAP is setting a great example for other funding programs by really prioritizing that inclusion.
It's pretty amazing.
Yeah.
As we wrap up our deep dive into SUAP, I want to leave everyone with one final thought.
Okay.
Remember, even though that 2023 call for proposals is closed, the fight against substance use doesn't stop there.
It's an ongoing effort, for sure.
There's so many ways to get involved and make a difference.
Yeah, absolutely.
You can volunteer at a local organization.
Mm-hmm.
You can donate to a cause you care about.
You can even just start a conversation with someone who might be struggling.
Every little bit helps.
It really does. Every
Exactly.
act of compassion, every effort to raise awareness, every voice that speaks out against stigma, it all contributes to positive change. So well said. It's a reminder that we all have a role to play in creating a world where everyone feels safe and supported to seek help and live a life free from stigma.
Beautifully put. And as we all continue to learn and grow together, it's exciting to think about what the future holds for these innovative solutions to substance use.
Absolutely. And if SUAP is any indication that future is filled with hope, possibility, and a commitment to building a healthier, more just world for everyone.
Couldn't have said it better myself.
So that's it for our deep dive into Health Canada's Substance Use and Addictions program.
Hope you enjoyed it
A huge thank you to all of you for listening.
and for joining us on this journey of learning and discovery.
Remember to like, share, and subscribe to timely trends and news so you never miss an episode.
We'll catch you next time.
Until then, stay curious, stay informed, and keep those amazing ideas flowing.